Hello. I am going to talk about specific events that have happened in my psychotherapy sessions from my Unit 6 journal. The ones that stand out to me the most, or I guess maybe I feel the most limited, would be in the marriage counseling sessions that we do in psychotherapy. And the reason for that isn't because I don't feel like that I have a lot to offer when it comes to the subject, but I think most of the theorists in psychology recommend that you don't offer advice, but that you let the particular individual come to their own understanding and come to that conclusion by themselves as to what is the best way to proceed. And that's extremely difficult for me because sometimes it's really easy in a marriage situation, especially if you're seeing the clients week after week, to pick out what the issues are. And it's not a good situation to just take one side or the other, and you always have to be open and remain open and non-judgmental, and just continue to portray that, and just remaining open and making both individuals that are in the therapy session feel that way is sometimes somewhat of a challenge. And so I guess that I feel like I am pretty limited as far as finding ways to continue to move a conversation in a couple session towards an area of growth that they both can agree on and that they see, without necessarily offering advice. Because as I mentioned, sometimes it's just more than obvious, sometimes uncomfortably obvious, that one person is much more at fault than the other person in a particular situation. And getting a conversation to go in a direction where that individual understands that is not always easy, without alienating that person. And you don't want to do that at all. I guess a strength that I feel like I have is just that I think that I can genuinely show interest in what a person is feeling, or in what they're experiencing. I think I have a good way of developing that therapeutic communication or that therapeutic relationship, making them feel like they can trust me. Something that I do feel like that I've come across that has been a struggle for me is just that I'm 44, and I think that a lot of clients, especially in psychotherapy sessions, want therapists that have a lot of life experience. And for whatever reason, maybe because I look younger than I am, a lot of clients just automatically assume that I have zero life experience. And so I feel like that is kind of a stumbling block and something that I'll have to come across. My specific and learning and insight in this has just been geared towards finding ways to shape a conversation that still allows the client to lead, but asking open-ended questions that don't lead the patient, and just applying this something specific that I've learned is just that it is always important to not judge, and to not particularly take a side, and just allow, as more information comes out, to allow your mind to be open to what you're going to discover. And that is the end of my journal for today. Thank you.